George's public persona, it was very manicured, and he himself believed that perception was everything. He wanted to come across like he was completely composed, very successful. When he went out publicly, he liked to be immaculately dressed, he liked to be very composed. But when you sat down and you had a chance to talk one-on-one with him, he really had this ability to bring you into he sort of had a magnetic draw to him. And one of the things that a lot of people come up to me and talk about is his infectious laugh. He had this unbelievable laugh, and that would really draw people in.
His personality was a lot different at home than it was out in public. We were the only ones that knew about his addiction and his mental health and all of the above, and so we really saw the two separate sides of my dad, whereas everyone else only knew him as this great, amazing person. And I think that's why it came as such a surprise to everyone when he did take his life, because we didn't tell anyone about the other side of him.
I felt completely hopeless. I felt like I couldn't navigate the system. I didn't know what the resources were out there. I was exhausted from dealing with a situation at home that when I thought of trying to find these things, I resented the fact that it was up to me, and it was so hard to find. The only option that we had really is just to go to emergency, just because you were dealing with it always in a crisis situation, and it was the only option. After George passed, because there was such a dichotomy with his public appearance and his private, I came forward to say, although you guys all had this perception of him, this is really what was going on. And the reason why I wanted to do that was to help other people be able to identify with their own situation and maybe feel more comfortable in sharing their story. I ended up talking to the mayor and said, all these resources are out there. They need to be elevated. It needs to be very clear, and let's do this for Calgary.
We need to make it a normal conversation for people to have. It can't be something that has the stigma around it where it's behind a closed wall and you tell friends that you're not feeling good and that you've thought about ending your life. It needs to be something that you speak honestly and openly with.
People think of mental health just being very acute. Not only does mental health have just an impact on those that are suffering from illnesses or addiction or whatever it is, but it's the families that are involved with the individual or with whatever is at hand as well that are really at risk too.
Stories like the Gosbys, stories of Calgarians. That's why we at the City of Calgary are developing a community action strategy on mental health and addiction. I'm Naheed Nenshi, Mayor of Calgary. Community partners are coming together with the City of Calgary to develop a community action strategy on mental health and addiction. This strategy will help us to better understand how to create hope and strengthen support for people, families, and communities living with mental health issues or addictions in order to help them improve their quality of life. If you're interested in finding out more, please visit us at calgary.ca/communityaction.